Hey guys, welcome back. Dr. David Rice. I'm the clinical editor here at drbicuspid.com. Last week's video was all about pre-treatment rinses. Now we talked about the science that we know, a lot of it based on bacteria and other viruses, and we talked about the science that we're sort of trying to know and best practices based on what we do know. This week, what I want to talk to you about is the elephant in the room, and this is happening everywhere in our country. Dentists and hygienists are unfortunately doing this. Now, here's what I know. Emotions are running high, both on the dentist side and the hygienist side, and it doesn't serve you and I, it doesn't serve any of our teammates, and it certainly doesn't serve our patients for us to butt heads. So what I want to do today is carry that PPE ball with some objective truths that you need to know your hygienists are hearing from the ADHA. That's their association, comparable to our ADA. So first things first, tasks. A hygienist tasks are being divided into two categories. First one, critical tasks. That's all the stuff that is with direct patient care. Hands and mouth, whatever that may be. Second, non-critical tasks. So think about the obvious, right? It's setting up a room, breaking down a room, sterilization, instrument restocking, all of that stuff that isn't high risk. So when you think about those two categories, understand for critical risks and critical tasks, the ADHA is not just recommending, but pretty strong stance positioning, telling hygienists to come back to work only if the dental practice has all the right PPE. Now you guys know what that is, right? We're talking N95 masks, we're talking face shields or goggles, we're talking about gowns, we're talking about headwear, we're talking about coverage for your feet, your shoes, down to the fact that those shoes shouldn't leave the practice. You should be changing your clothes in and out of the practice. But I think the key factors I want to talk to you about today is that list is when you and I provide that to our hygienists, then the ADHA, from a perspective standpoint, is in total alignment with where we are as dentists and practice owners. If we veer the slightest bit from those N95 masks, which are fit tested, along with the face shields, the gowns, head, foot protection, etc., then the ADHA is telling hygienists to not go back to work to treat patients. So I know that's a hard pill for some of you to swallow. I'm not here to tell you right from wrong. I am here to share that's objectively what hygienists are hearing from the ADHA. And if life is perspective and perspective is reality, then what we need to face so we don't do this is an understanding of what your hygiene team is coming to you with and why they're coming to you with that. So before you get really angry at your hygienist, before you get upset, before you jump back and push back, take a look at the ADHA guidelines. Understand what your hygienists are being told by their leadership. Reach out, extend that olive branch, do all the right things for PPE that you know, follow those guidelines. And guys and gals, let's do our best to come together because you and I need our hygiene team, our teams need us, and most importantly, our patients need us. Our patients need us to come back. Emergency care, urgent care, depending on where you are on this timeline, we're gonna get to routine care. We gotta do this thing together, guys, because remember, together we rise.